Texas health officials are warning that whooping cough cases in the state have hit an 11-year high. According to a state health alert, more than 3,500 whooping cough cases were reported in Texas between January and October. That's around 4 times as many reported during the same time period last year. Whooping cough is highly contagious in children and can sometimes be deadly. The surge in cases corresponds with a drop in Texas's vaccination rate for the illness. Dr. Philip Huang joins us now. He is the director of Dallas Health and Human Services. Doctor, thank you for being here.
Thank you.
How serious is whooping cough for the average person or child? What are the symptoms and how does it spread?
Well, it starts like as a common cold symptoms, but maybe 1 or 2 weeks later, start to get severe coughing, uncontrolled coughing, severe coughing. And in infants, then, the kids can turn blue and choke, vomit. It's very serious, in particular in younger kids, less than 1. And so but it's very preventable with the vaccine, or getting the vaccine is so important to control this.
Let's talk about this. Who is a candidate for vaccines? Are there boosters? How often should people get them?
So there's a whole series for kids, 2 months, 4 months, 6 months, 15 to 18 months. Then also one thing that's important is for pregnant women between weeks 27 and 36, it's recommended they get the vaccine because that protects then the newborn during that first 2 months also before they get their first vaccine. So those are, again, completing that childhood schedule. Then there's another one at adolescents around 11 years old of age. So the most important thing is for everyone to stay up to date on their vaccine schedule.
And forgive me for this rudimentary question, but can a child who has been vaccinated still be susceptible to whooping cough?
Yes, they can. I mean, the vaccine does wane, but the vaccine, having that protection definitely protects against more serious illness and that whooping type of cough that you see with this. So it's important for people to get and stay up to date on that vaccine, but you can still get the illness, but much less severe.
I'm almost out of time with you, but what does Texas need from the federal government to help tackle this?
So, we need, I think, a lot of consistent messaging that supports everyone getting the vaccine. These confusing messages about vaccines undermine a lot of our efforts to get people vaccinated and put questions in parents' minds. And, keep up the supply. The Vaccine for Children program is one of the programs that we really depend on to provide vaccine for our kids. But I will say that our vaccine rates for childhood vaccines went down considerably this year because a lot of our population is afraid because of some of the ice concerns.
Can you elaborate on that really quickly? I am out of time, but can you just elaborate on that?
Yeah, I mean, this year for back to school, we saw the number of back to school vaccines were dropped in half from like 8,000 to 4,000. And we've seen dramatic decreases. And we think, in Dallas County, 40% of the population is Hispanic. And I think a lot of our population is afraid to come out.
Dr. Philip Huang, thank you.